This is the next talk about transfer medications, and the title of these is Antihypertensives, and the talk will include a little bit of information about nicardipine, which is also known as cardine, and nitroglycerin and nitroprusside. So the first of these is cardine, and cardine or nicardipine works by relaxing the smooth muscle in the coronary arteries, so increases blood flow to the heart itself. It also prevents coronary vasospasm, which is also known as Prinzmetal's angina. And it does this in the muscle tissue as well, throughout causing just a general decrease in blood pressure. So nicardipine is very rapid in onset and slow in offset. So if you turn off this strip, don't expect the hypotension to go away very quickly. So its uses, again, coronary vasospasm and then hypertensive emergency, like intracranial hemorrhage with hypertension. And this drug is contraindicated, as are really all the others. And I won't mention this again for each specific medication, but for aortic stenosis, because reducing the blood pressure too much in aortic stenosis will lead to a lack of perfusion in the coronary arteries themselves, and that reduces in fairly rapid, or produces, or can induce arrhythmia and death. That's about it for nicardipine. The next medication on the list is nitroglycerin, which I think we're all pretty familiar with. It is used for chest pain and congestive heart failure, and believe it or not, even eclampsia, although we typically will use labetalol. It's just easier to give pushes of labetalol than setting up a drip. But its mechanism of action is to form nitric oxide within the vasculature, and this relaxes the veins and the arteries to reduce mostly preload, which means that it's much more active on the venous side of things than arterial. So if you think about it, it's almost like a very rapid acting Lasix, where it decreases your preload, which of course affects your cardiac output and therefore your afterload, or your systolic blood pressure is kind of the way I just think of afterload. It also dilates the coronary arteries, kind of like nicardipine, to improve coronary flow. But just so you know, I thought I'd mention it, there is no mortality benefit proven for the use of nitroglycerin in angina or chest pain in general. So nitroglycerin, when given intravenously, has a pretty much immediate onset and offset. The offset is about 3 to 5 minutes. And contraindicated, we don't use nitroglycerin with phosphodiesterase inhibitors, which are all of the erectile drugs like Cialis and Viagra. We also don't use them with pre-existing hypotension. That kind of goes without saying. And the most common side effect of using nitroglycerin is a headache, believe it or not, even far more than hypertension, according to the literature. So, next drug in this class of antihypertensive is nitroprusside, which is also known as Nipride. We use this, I think, a little less frequently because it has some limitations, which we'll talk about. But we do use, the use cases for it are decompensated heart failure and really any hypertensive urgency or emergency, like a AAA or thoracic aortic dissection. It works sort of in contrast to nitroglycerin by dilating the arteries much more than the veins. So it's an afterload reducer rather than a preload reducer. And it has an extremely rapid onset and offset of action of about 2 minutes. And you have to be very cautious titrating this medication because it's some powerful stuff. And go slow and let things equilibrate before making any more adjustments. This medication, so some of the problems with it that limit its use are that you have to protect it from UV light or it deteriorates. So you'll always see this medication wrapped in a silver bag. Also, more prolonged use, and it kind of depends on the patient's clearance of the toxic byproducts, but when you introduce sodium nitroprusside into the body, cyanide is produced, and so believe it or not, these patients can develop cyanide toxicity. That typically happens at higher infusion rates, but it's also with more prolonged use. And interestingly, tinnitus or ear ringing is one of the earliest signs of toxicity. And what you would do, you know, in my opinion, honestly, even for tinnitus or the ear ringing issue, is just go ahead and stop the drip because you know, you don't want to develop cyanide toxicity, which is going to hamper oxygen utilization both in the brain and elsewhere, which is going to probably make the underlying problem worse than the hypertension would have. So that's it for this class. See you in the next video.